Welcome to Unfuck Your Life and Relationships with Anita Ashley, psychotherapist and author, and Ryan Rossman, recording studio owner and music producer. This is a podcast like no other. Sit forward, listen in, and get ready to get unfucked from the inside out. Unfuck your life! Unfuck your life!
Hey guys, welcome to another session of Unfuck Your Life and Relationships. Today, we are back in studio. Ryan's here.
Hello.
And Amanda.
Good morning.
How are you guys doing?
You know, living the dream.
Fine.
Well, this
Fine.
Fine. No, we don't go there yet. They just had a little thing before the thing. We're not gonna get into that right now. What we're gonna talk about today is psychotherapy. What is psychotherapy? Well, as a psychotherapist, I will give you an operational definition of it, and then we're going to dissect it and talk about it. It is one of those things that people are very curious about and afraid of. Some love it, some don't. We're going to get into all of that. But I will give you a working definition to help you out, guys. It is a process that refers to a variety of treatments that are designed to help people identify and change dysfunctional emotions, thoughts, and behaviors. And treatment, of course, is determined by the clinician's theoretical orientation. What does that mean? Everything we do in the office is driven by some theory, some theory that's been designed. The first one was obviously from Freud. Well, I say obviously, but not obvious to most people, was psychoanalysis. And I'm sure most of you are familiar on some level with that. You know, the person lying on the couch and the person behind it. Freud came up with that. He's the founding father of talk therapy, Sigmund Freud. And he is the one who first talked about the unconscious, the subconscious, and the conscious mind. He contributed a lot to the field of psychotherapy, even though some theories today move so far away from him. That's okay, but theories are really going to determine what the experience you're going to have with your therapist in the office, the modality that they believe in. There's cognitive behavioral therapy, which I'm sure most of you are familiar with. You've heard about it, CBT, if you read some of the stuff. It is, very concrete in terms of what we do with people in the office, clients in the office. There is behavioral therapy. There is the humanistic approach. There is systems theory. So all of this to say there is more than just talking and listening that's going on. That is a foundation of it. But more than that, because people say, what really happens? You guys just kind of sit there and listen. I'm like, yeah, okay, you might have that impression, and we do some of that, but a lot of what we do is based on our theoretical framework, which of course determines, as I said, treatment and then diagnosis and all that clinical stuff. I want to talk about today the therapeutic relationship. What happens in that office between the patient and the therapist, but also what happens to the relationships around that person who's in therapy. But I also want to talk about my perspective as a therapist, and I've shared this before. I have sat on both sides of the couch. During my training, I was required to go for my own treatment, and I remember thinking, there's nothing wrong with me. And, if you're going to read my book called Unfuck Your Life and Relationships, available on Amazon and Simon & Schuster, I do share vignettes of my own private sessions with Dr. Frank. And I remember walking into his office and saying, Dr. Frank, I'm only here for didactic purposes. Fancy term to say learning experience. And he just kind of looked at me like, all right, sit your ass down. He didn't say that.
He didn't laugh.
He goes, well, yeah, he probably did. But he said, yeah, okay, sit down. Thank you for telling me that. Of course, he was well aware of that because he taught at the institute that I was going to. But then twice a week, 6 years later, I was like, oh my God, I never want to stop. And it just became this experience that I still hold on today at the age of 55. I started, I think, in my 20s, and I would have never stopped. I had to move from Montreal. And of course, it's such an intimate relationship that he could not be replaced. He still can't be. He's retired now, and I remember calling him a few times throughout the years, asking for some advice and seeking his opinion on just being a therapist myself, but also as his former patient. But all of that to say, it is, from my perspective as the patient, it is one of the most intimate relationships I've ever had with a man, the most different relationship I've ever had with the man, the most unique, I should say, that's the proper word, but a relationship that terminates also in a very interesting manner. Most relationships, if you think about it, they usually end because there's a fight. Somebody dies, somebody moves away, and that might, the relationship might not continue. But the therapeutic relationship, when you think about termination, the termination in and of itself from therapy is a whole deal because people do become attached to their therapist. I was very attached to him, and to let him go was such a difficult process. So termination is a very interesting process of therapy. And as a therapist sitting on the other side of the couch, I'm like, yeah, I help clients do that all the time. But then people say, well, when should termination happen? That's a whole nother scenario I want to get into later on, that Amanda's going to share her views and Ryan's going to, because Ryan said he doesn't need therapy, but we're going to talk about people who say those kinds of things.
I absolutely need therapy.
Yeah, I'm joking. He knows. We all in here are very supportive of the therapeutic process and therapy itself. But I just want to talk about, before we listen to your stories, guys, the concept of change, because every theory out there is trying to answer one question, which is, how does change take place and how do we best help people change? Theories are trying to answer those questions, and the way they answer them is different. And depending on your orientation, that's what you're going to do in your office as a clinician. So we just want to, stop that stereotype out there that we just sit there and listen, don't do anything. No, everything that we do is driven by our theoretical framework and what we believe about change and how change takes place. And psychoanalysis, people poo-poo and say blah, 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 all these negative things about it, but it was the first theoretical framework for talk therapy, going back to Sigmund Freud, the founding father of talk therapy. And although I was trained in psychoanalysis, my theoretical orientation is an integrative approach, meaning I borrow from various schools of thought because I believe no one theory can answer the question of how do people change. And that, of course, is executed differently depending on who is sitting in front of me and where they are in their process of change. And change is a huge word. It's threatening. People are scared of it. They want it, but it's uncomfortable. But all of therapy is about helping people create some kind of change in their life. And sometimes when people come in and say, well, Anita, I used to feel much better before I started to see you. So then I'm like, yeah, it's all my fault. But change is uncomfortable. And the answer to that, I always say, well, of course it's difficult and your life is shit will hit the fan before it gets better, because walking around in the world out there, you can be in denial of all this stuff, but in here, eventually I'm going to confront you with some of your stuff that's going on, and that's going to be uncomfortable, because anytime we are seeking to make change, it's uncomfortable. We're sometimes very comfortable in our misery, even though we don't like it. It's comfortable. It's familiar. It's a familiar place. So of course, change creates a feeling of, oh my God, what's happening? And I always remind them, listen, dude, you came to see me. I didn't come to see you. But when people start to feel like that, it is really important for the therapist to be able to draw them back into the room. Because at that point, people start canceling appointments. I'm not coming. I'm sick. This is going on. And that's happened to me. I've been on the canceling side. I did that to my own psychoanalyst when things were getting difficult. And then, of course, I was really pissed with him because he's like, well, if you don't come in, and I shared this story in the book because it's very relevant to what we're talking about today. If you don't come in, Anita, I'm going to charge you. I was so fucking pissed. I'm like, I'm a student. I'm poor. I have no money. I have a test to study for. That's why I'm canceling. He said, this is like the second time you've canceled in a row. And I'm going to charge you, and I might even fire you because you're not very committed at this point, and I'm totally committed to you. And then I was like, oh my God, he doesn't love me just like my father didn't love me. All that transference comes into. And then I will tell you, that was a turning point of my therapy process with him, the experience. It took on a totally different, it went to a completely different level in terms of emotional intimacy with him. I totally took the process much more seriously. And I thought, okay, I need to invest in this more emotionally. I'm kind of just playing around. But it is when true trust between him and I started. And then I also learned, and it's an interesting position to be in. So I was the patient, but at the same time, I was training to be a therapist myself. So he said to me, I charge you because that's the ugly part of therapy, the business part, but it is a business and I'm running a business here. You keep canceling on me. The other part of charging you is to help you understand as a student. Remember, you came for didactic purposes, right? Is that people want to jump out of the process when it gets difficult. So they start canceling. And what you have to do is you charge them, even if you're uncomfortable with charging them as a therapist, because when it hits you in the pocket, most people will have a reaction to it, right? When you have to pay for something, you're going to look at it very differently, especially if you are not present and you're paying for a service that you're not present for. So that's part of getting people back in to say, okay, I'm going to have to pay for this. I might as well go in. But the secondary part, which is really important to the therapeutic process, is you were trying to run away from me. I don't want you to run away from me because I want you to work through this issue. Out there, you can run away all you want. But in here, we've been working for so long. And he did. He said, we've been working for my phone, my bad. We've been working together for almost a year, and we would have a pivotal point talking about your dad and your feelings of rejection and all of that. And of course, you want to run away. You tested me to see if I cared about you or not. Because I did say to him, I said, oh, you don't care about me, and that's why you want to charge me. I thought you actually cared about me. And if you cared about me, you wouldn't charge me. He said, I'm charging you because I care about you, if that makes any sense. What do you guys think?
No, absolutely, because you have to not only be like super committed to that, but then like the routine of everything I think is important because you sort of build up, momentum and all those things. And then you stop and it's sort of like you have to kind of reset a little bit. And you also have to this person is putting a lot of time, although you're going to them and paying them money, they're putting a lot of time and brain power. And sometimes it's outside of those sessions into what's happening. Yeah, and you got to be committed to it.
Accountability, I think, helps for anything. Like if you're trying to stick to or do anything, when you're given a sense of accountability, it can be the make or break ingredient in success.
Yes, and also part of I say to people when they try to make me feel guilty, because now I do it, I charge my patients too for all the reasons we just talked about, is I say, listen, your doctor would charge you, your dentist would charge you. Why is it that when it's in this process, it's such a hurtful thing that's happening to you? Because it is such an intimate relationship and it is such an emotional experience to go through. If you stick with it long enough and you have a good connection with your therapist, you do feel like a sense of, wait a minute, if you cared for me, you would be so empathic that I couldn't come to this session, or I'm feeling this way and I can't afford it. And then as an effective therapist, it is trying to balance the two so the client doesn't feel rejected or hurt by the fee, but then you can explain why you had to do what you had to do. It's ugly. It's uncomfortable. I've had to do it. And, I went through it with my own therapist, but I understand it now also from the side of a patient, but also from the side of therapists. And I think that's why all therapists out there should have their own therapist, because they need to learn how to do all this stuff and they need to experience the injury that sometimes we feel being on the other side.
Sure. No, I think also to that point too, I think the most valuable thing that we have is our time. Yeah. And you also want to make sure that people are respecting and valuing your time as well.
Yeah. But sometimes therapists, because we're helpers, and I've done this, I've given way too much time and that time hasn't been paid for. But I remember, I'll go over the hour, the 50 minutes or whatever, and I won't charge for it. And my therapist used to say to me, so you don't value yourself. You don't value your profession and you don't value your time and you don't value yourself. And I said, no, of course I do. I was very defensive. But in thinking about it, I actually have an issue with that, and I really had to work on that. For me to even increase my fees with my patients, I was like, oh my God, this is so uncomfortable. And I had to really make sure that didn't come across to the patient, because they'd pick up on my own anxiety about it. That took years. Because in the helping profession, we kind of struggle with some of those things. We undervalue the service. And that's from undervaluing ourselves. And, I'm an open book. It's in the book. I suffered with that for years, not valuing myself. And that came across in how much I charged people, because my colleague would be like, what are you charging? Are you kidding me? Stop that, because you're devaluing our service.
I definitely have that problem. I don't know the value of my time.
You put so much time and brain power
into everyone and everything. I have a really hard time with it. Yeah. I will say that.
And I get it too. I mean, I think we all have that. Like, I struggle even setting my prices, at the studio and doing extra things, going above and beyond the same way.
Rates here.
It's like
artists, we don't want to charge
artists. And psychotherapy.
Want to help everybody.
Right. And psychotherapy, people forget it is a form of art, and we're in the helping profession. And sometimes it's, I have gotten this in my mind, when I was younger, that I'm helping, I need to help. And they're right. I should give them more time, and I shouldn't be charging so much. They can't afford it. But then I have to put my business hat on and say, wait a minute, you invested a lot of money, a lot of time in your career, and you have to value yourself and value the process. And money is a part of that. It is a business. If I was, if I had a lot of money.
I sort of have a question for you.
Yeah.
Thinking about that and like the weight of taking in everyone's most difficult things in a concentrated hour.
Yeah.
Like there's also, I would imagine, like, is there decompress time that you need? Or like, how do you walk away from it and not just be burdened by all of that heaviness that's brought to you in sessions?
Yeah, that's a very good question, Amanda. Freud would say, well, I have the 50-minute hour and 10 minutes I decompress and switch. But I don't believe that to be true. Well, going back to my history, I was always a therapist. I just didn't know it. I was the middle child, right? I had my mom coming to me about my dad shit.
You're born that way.
I was, I had my two brothers sandwiched between them. So I was always a therapist. I was always taking on people's issues. But my own therapy helped me to realize that and unfuck some of that stuff. But getting back to how I deal with it today, I like to, from the practical part, I go back to back, boom, 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 boom. And I can do that. And it took years to kind of train myself to do that. But I have my own therapist. Every therapist should have if they don't. But I have my own therapist that Dr. Frank was really hard to replace. But that somebody I check in with, because it is a lot. And I think as a therapist, I need to feel balanced myself, because if I'm not, how do I help other people feel balanced? We don't want to be the wounded healer. There's a lot of people out there who are practicing therapy and they themselves are so wounded that sometimes it's ineffective. And we're human, of course. I went through a recent divorce, and I had to take some time off to myself to heal from that so I could get back into my office. But that gave me a lot more empathy for what I was doing with people who are, going through a divorce process, all the ups and downs of that. I not only knew it theoretically and from experiential experience with other clients, but then I knew about it personally myself. And I had to go through my own healing process, but we need to decompress. And that's why we don't work 40 hours a week. Therapists generally average 25 to 30. And I know clinicians who work 40 hours, and I'm just like, and they're burnt out. And I'm like, at what point are you ineffective? And sometimes I could work a later hour, but then I think, no, that person is going to get the worst of me. And I don't want anybody to get the worst of me. But, that happens anyway. That's part of life. Like, probably go to the doctor. And if I'm the last patient, I know he's probably, or she is probably really tired and we're done. And that's normal and natural, but I really try not to. But I've had clients who have said, I used to see this therapist and she literally would fall asleep on me. So these are the nightmare stories. And I'll tell you this.
What?
No,
my
I'm
God.
not kidding. And she stayed with that therapist for a year. Guys, I want to tell you something.
What?
If you don't like your therapist or are uncomfortable with them, first talk to them about it, right? I do think you should talk about it because maybe there's something else going on that you're projecting onto the therapist. But things like falling asleep. So I said to her, what? I didn't even understand how that can happen because when I'm sitting with the patient, they're looking right at me. I'm looking right at them. It's a very I'm like, how do you get away with that?
It's a pretty
How do you even get away with that?
situation.
How do you do it? But this person stayed. It was twice that it happened that the therapist fell asleep. I'm like, oh my gosh. So anyway, if that's happening to you guys, change therapists. That is totally wrong, inappropriate, should not happen. I can't even imagine that happening to me. Not funny, but not funny, right? But people, it's an example of how when people get used to somebody, they stay because again, going back to the concept of change is harder. But I'm like, seriously, you're paying for this person. They're falling asleep,
Yeah.
Change is hard. But sometimes change is necessary, especially in that situation itself. I don't want to ask you guys your opinion and the talk that goes on in your friend circle, family about psychotherapy.
Well,
or your experiences that you've had.
I'll say this. I think myself included, there's a lot of talk about like, oh, therapy's great. Everyone should be in therapy, but I'm not currently in therapy.
Yeah.
We all say that.
Yeah.
Right. But like, are we doing it? And I think one of the biggest barriers is cost.
Yeah.
Right. And a lot of insurance doesn't cover it.
They don't want to pay for it.
They don't want to pay for it, which is just a huge barrier because it's just as important as like the brain and the foot and the hand and everything else.
It is.
And so I think that stops a lot of people. And I wonder, like in a societal way, like how do you unfuck that? How do you unfuck access to mental health care? Because
what they charge is what they're worth.
Yeah.
And it's not about lowering prices.
Yeah.
It's not
it's
that.
access and availability what you're talking about. And I want to say, because you're a creative person, so you're around very creative people who say, everybody should be in psychotherapy. But I know a lot of people who really poo-poo psychotherapy and they think everybody else but themselves should be in therapy. And they're like, oh, what is that anyway? You guys just sit there and talk. And what do you do? And I want to say something. I listen to people say that around me, and I always look at those people. They're the most fucked up people. And I think, you are the one who should be in therapy, but everybody around you is in therapy because that's what you're doing. That's what you're exuding, so much stress. So I just don't like it when people make those blanket statements about any profession, because especially about psychotherapy, when they have no idea what the fuck goes on in a room and they're afraid. To be honest, when people say that to me, I'm like, okay, it's because they're afraid of change. They're afraid of what might happen. They're afraid of confrontation. But getting back to your point about fees, the fees, and I struggle with this all the time with establishing a fee and explaining to people. But now, I should correct myself. I used to struggle with that. I don't struggle with that anymore. I struggle with insurance companies. They are the necessary evil. And I'll tell you, United Healthcare, which I work with, they're a great company, good to their providers and so forth. But some are not, and they will not pay. And people don't know this, and I explain this to people. They will not pay. If you came to see me and you say you have relationship issues, they will not cover that. And most policyholders don't know that. What they will cover is some generalized anxiety disorder, everything that's in that Bible, the DSM, Diagnostic Statistical Manual of Mental Disorders. And sometimes therapists are forced to say, well, are you comfortable? You seem a little anxious and you exhibit some symptoms of anxiety. I'm going to give you the diagnosis of generalized anxiety disorder. That is reimbursable. That is billable. Is that unethical? It could be seen as being unethical. But how do people, because people want to use what they've been paying for, but they don't realize for therapists to get paid, we have to give you a diagnosis that the insurance company likes. That's billable.
But is it like a CMT code or something?
It was a CMT. It gets all ugly. But what I'm trying to say, when people call me and say, okay, look, we can use your insurance, but you're going to have a diagnosis. That diagnosis is going to stay on your medical record. And the consequences of that might be if you're going for life insurance or whatever, they're going to see that. And and I usually negotiate my fee. I said, you know what? If we don't use insurance, I will reduce my fee. It makes it easier for me. I don't have to deal with the insurance company. I don't have to report to anybody. Because even though HIPAA is in place, I still have to make a diagnosis. I still have to report that. It's confidential. However, if you go for life insurance, it's not. The information of the sessions is confidential, but the diagnosis and that you went for psychotherapy is not. But I do try. But what I will tell to people who come to me and say, well, I want to see you, but I can't really afford your fee. In that situation, I try to negotiate a fee because I love what I do. But I try to put it in perspective. I try to say to them, what I do say to them is that it is something that you will appreciate not only today if you have a good experience, but you will appreciate later. How much do you spend on alcohol? How much do you spend on going out? How much do you spend whatever. I said, you go home and think about it. Which one is going to be more beneficial to you? And you come back to me. Because, yeah, the fee is part of the service. We have to charge a fee. But I understand that availability and accessibility is limited sometimes to people. But I do think people can do it if they just cut out the other stuff. In Wisconsin, if we just start drinking less.
Yeah, I don't think that's happening.
There's a lot of drinking in Wisconsin. I see a lot of that going on. Like, yeah, you need some therapy. Stop drinking and start paying for psychotherapy. There is a way. I think if we want to make it happen, there is a way. Because there are therapists who work on sliding fee scales. You could actually go to training institutes, which I think is great. Where I trained, the sliding fee scale was 0 to 50. You know, if you can't, depending on how much money you made. And I think I was in training. Everything I did with the patient was under the microscope, not only with my individual supervisor, but I was in group supervision. So you not only have the benefit of this person who's in training and a reduced fee, but then you have 5 other experienced therapists who are also in the session with you abstractly.
And how would you find a place like that to go to? Like,
you
what
just
would you Google?
Training institutes.
Training institutes?
Yeah, training institutes. And then you can make an appointment at literally $0 to $50.
I'd never heard of that before.
Maybe we should find some and add links.
Yeah, we should do
that. I'm super curious, like in Milwaukee. Because I know there are so many people that, like, there are people that I know that need the support.
Yeah.
But aren't in a position where they're making a choice. It would be like their rent or food, you know, where they couldn't do that, where they truly need that sliding scale, but maybe don't know that that's even an option.
It's available. It is available. And just check out training institutes in your state, in your area. And those clinicians have to be trained somewhere, and we are required to get supervised hours in working with people. And I think it's a great way for people who can't afford the service to get the help that they need. So
that's dope.
Yeah. Well, it's like I live downtown, so my daughter went to get her hair cut but it's kind of similar. And she went to there's a place downtown. She went to a training institute. And they cut her hair. I don't know what it was called.
Yeah. Absolutely. Yeah. A lot of those places. Yeah. Aveda and Neroli.
Yeah, that's what it is. Aveda.
Yeah.
Oh yeah. I get all of my things done downstairs in the salon.
So it's kind of the same thing. It's hairdressers in training. They have somebody supervising, so they don't.
Yeah. I mean, doctors are.
It's the same thing.
They're doing the same thing. Yeah, right. All that stuff.
Attendees and residents is the same thing. So that is available out there. People don't know it. I also want to say that it's from being as a therapist, I have friends who have come to me and have said, oopsie, we just dropped something. That's okay. Say, hey, will you see my son or my daughter as a patient? And I have had this experience happen, and I have said, well, do you know what that means? If we choose to do this, I will know everything about your life. I will. And they'll say, well, no, I'm not really going there. He or she is not going for that purpose. They're going there because they're suffering from some kind of anxiety. Say, if we use that as an example. And I will say to them, well, okay, but if I have to choose, I'm going to have to choose the therapeutic relationship over our acquaintanceship or whatever, the context of our relationship is. And I've had that happen where years later it's problematic and the person will call me and say, well, my son went to see you and it was all, making great changes and so forth. But he comes home and I ask him about therapy and he doesn't want to talk about it, but he kind of told me what you talked about. And I don't think he should be talking about me. And I'm just like, okay, you don't get the concept of what happens in psychotherapy. Most of us are sitting in that room talking about a relationship, and it's also to do with our parents and what happens in our parental relationships. What goes on in our household is all revealed and talked about in the therapeutic office. But somehow people have this vision that when the person goes for therapy, they're just talking about themselves. No, every person sitting in a therapeutic room is talking about their relationships and the parental relationship. So I knew everything, and it was very uncomfortable for them, and I had to stop talking to her because this is privileged information. I don't even want to know about this. But people think, they're just going to talk about themselves. No, we talk about everybody. There's somebody right now probably bitching about me in their therapy session. I'm just saying. And when my kids say, "Oh, Mom, I can't believe you did that to me," I'm like, I'm just giving you food for when you go for therapy one day when you bitch about me. If I was a
You're
perfect
gonna need
parent,
something to talk about.
Yeah, exactly. I'm like, if I was a perfect parent, you have nothing to talk about in therapy.
Boring.
How boring would that be? I'm creating content for you. Everyone is talking about a relationship in therapy. They're just not talking about their internal workings. They're talking about a lot of other stuff that involves other people. This is such an interesting conversation, and we are going to continue talking about this on the next episode. Stay tuned, guys, and thank you so much for joining us today.
Unfuck Your Life and Relationships was recorded at High Five Studio in Milwaukee, Wisconsin. Unfuck your life! Unfuck your life!